Everyone, it's another Wednesday with your fertility specialist. On behalf of ALPS Hospitals, I welcome you to a very interesting session of a day with your fertility specialist. Thank you, dear viewers, for always staying glued to your screen, for always liking our posts, for sharing, even as we're starting right now. Please share this link with someone, call up someone, drop your thoughts, your comments in the comment section, and would respond to them appropriately. We're talking about vaginal health of a woman. Practically, that's what this is all about today. And to talk about this, we have a very passionate doctor with us, Dr. Jane Ojiani. It's good to have you with us.
Thank you.
Yes, a bit about Dr. Jane. She's very good looking, as you can see. Yes, she's a consultant gynecologist. She's a minimal access surgeon. She's also a fertility specialist. So it means that we couldn't have had a better person talk about what we're about to talk about today. Highly passionate about women's health, their experience with fertility, their experience with reproduction. She's highly passionate about that. And this means that she's here to give you the best of answers to every question it is that you might have actually been struggling to understand or that you've been searching for answers. Today, Dr. Jim will give us those answers. Once again, Dr. Jim, we're happy to have you with us today.
Thank you very much.
So, viewers, we're talking about vagina and pelvic health. Well, yes, I know that some people will say this is a woman's topic, but it doesn't mean that as a man you can also not be part of this session because you have sisters. If you feel you're not married and you don't have a wife, you have sisters, you have a mother, you would also have a wife, you would have a daughter. There are some people that don't want to have daughter as children. Oh yes, actually I know of someone that said she doesn't want to have girls as children. She just wants to have boys because of what she has been through. Well, yes, I mean that's coming from the trauma that she has actually experienced in life. Well, it's good to have a balance to each other if you have the opportunity, and if not, you accept and move on. We're talking about vaginal health and pelvic health. So I would want to even when we even talk about this vagina and pelvic health in general, what do we even refer to that? What does it refer to?
Okay, so when we talk about vaginal health, we're not just talking of the vagina and appearance. Now we're looking at the health and function of the vagina, the vulva, the pelvic floor. That's the group of muscles that support the vagina, the uterus, the um, intestines or the bowels, as we would call them, the bladder. Also talk about your sexual health and also other surrounding structures. So they have to function properly. And that's why we talk about vagina and pelvic health, not just the outward appearance, not just scars or injuries on the vagina, but its health in totality.
Hmm. Wow. So if you know us at Alps Vera, you know that yes, we're very passionate about every clients or individuals. We want to give you the best. We were passionate about hospitality, we're passionate and talking about vaginal and pelvic health, it means that we're concerned about the whole being of a woman. Yes, fertility and all of that, yes. And that's why we thought it very necessary to actually talk about it today. And Dr. Jane has made us to understand what the whole health we're referring to is about. Okay, so I would want to ask, I know that as women or as ladies, as they grow or as age hits, as age passes by, different they experience different changes. So I would want to talk a bit about the changes that happens with a woman's vagina at pregnancy, at childbirth, and then the changes that happens with a woman's vagina as she ages, possible things that they actually would experience. Yes, let's talk about it. So we make them feel they are not alone. they can understand and have explanation to what they're actually experiencing.
Yeah, so during pregnancy, the pelvis, or a lot of women, the vaginal health, the pelvic floor experiences a lot of pressure
Mm,
from the growing uterus,
mhm,
which can also contribute to the weakness that some women eventually have and develop some of those symptoms of weakness of what we call the pelvic floor,
mm,
which are introduced as a group of muscles that
yeah,
support these structures, help
yeah,
to keep them in place. Talk
mm,
about the bladder, the uterus or the womb, the intestines, and all, because it's through that floor that you also have openings to these
mm,
structures. And when this floor is weak, it can cause some of these symptoms we experience after childbirth.
mm,
Now, during childbirth, alongside the pressure you get from pregnancy, during childbirth, now there is now stretching and sometimes tearing of
mm,
these muscles, further increasing the weakness that this
mm,
floor can experience. So, as they age too, so a lot of times the estrogen too, estrogen is the major hormone
mm.
produced by women during their reproductive age and is
Okay.
responsible for support of most of the structures in the body.
Mm,
Like we can talk from the brain to the feet of a woman.
mm,
So it also increases the strength, the stretchability or elasticity of the
yeah.
vaginal walls, also supports the floor and all of that. So with
Mm,
menopause, all the weakness, there's a weakness of this floor, which increases their risk
mm,
and women's risk for what we call prolapse, urinary incontinence.
mhm,
So prolapse is when the structures are pushing through the vagina.
yeah.
So because of weakness of their support structures, now these estrogens are supposed to maintain some strength in these
Yeah.
structures.
Mhm,
And also the vaginal wall, as they age, as women age rather,
yeah.
the estrogen to supply to the vaginal walls is reduced. So
Mm,
it reduces its elasticity,
yeah.
its strength. So a lot of women as they age complain of pain during intercourse,
Oh,
bleeding. It also
see.
thins out the walls of the
Mm,
vagina and all of that. So those are the different things that can happen. So in pregnancy, not so much. So is the pressure. We talk about the flow.
mm,
Yes, so we also have changes that will come with the hormonal changes in pregnancy,
yeah.
but those are not significant problem causing issues. But when I talk of the pressure, talk about the stretch, like the
Yeah.
tear, pull and tear that
Mhm,
happens at
mm,
delivery,
mm.
especially when you have deliveries of very big babies,
Babies. Mm,
or you have some special obstetric procedures like delivery with assisted deliveries with forceps and all of that,
mm,
extensive tears, all of those can affect the flow. And again, there are untoward implications and how it would affect a woman's health
mm.
eventually.
And I was just thinking, so sometimes I've heard some people say that they have this is it leakage of urine maybe when they laugh or well, what could possibly be a reason why some of them actually have that? Because I've had a few people talk about it that sometimes just laugh or if they laugh too much,
Well, the
like they just
proselytes,
yes, as if there's just a little release of
sprouting of
yes of
urine when they
yes exactly.
yeah, so that can happen from a lot of causes, but we know that deliveries to pregnancy
Mm-hmm.
can cause that. Now we have established that there is a weakness on the floor. Now
Yeah.
this can happen. It's called stress urinary incontinence,
Oh,
and
okay.
it's anything that gives stress on the bladder.
Mm-hmm.
Now when women cough, they increase pressure in the tummy, which can be transmitted to the bladder.
Oh.
When they sneeze, they can
Mm.
have the same thing.
Oh, I
So when
see.
they bear heavy load or
Mm.
things that are very heavy, they can have this pressure
Pressure.
in the tummy.
Okay.
When they strain too
Mm.
much from constipation, chronic
Mm-hmm.
constipation,
Mm-hmm.
they can have all of those. Now we have established that with the pregnancy, delivery process, even menopausal state, there can
Yeah.
be weakness of this flow.
Mm-hmm.
And we had established that this floor has the openings to the bladder,
Mm-hmm.
to the bowels, that's the intestines,
Yeah.
the
Yeah.
and the uterus.
Yes.
Now, during when the floor is functioning maximally,
Mm-hmm.
once this pressure increases, they tighten or they
Oh,
contract or they close
okay.
up. So
Mm.
you don't get to see those leakages. So
Okay.
when
I
it's weak,
see.
it cannot perform that
Oh.
function and
What
that will
happens?
lead to that eventual leakage. Yes, so
Okay.
you can have that from aging process. Even the menopausal state, we established that estrogen also supports this flow, the strength of the muscles.
Yes.
So you can have that. Of course, for some other reasons, genetic reasons, people that have what we call collagen deficiency can have
Okay.
this weakness. And
Mm-hmm.
of course, some procedures help to increase collagen secretion in a
Mm-hmm.
place to improve the strength of these muscles.
Okay, so viewers, hope we are noting. So for a lot of women watching or that would watch this eventually, I know that you might have wondered why you're experiencing some of these things, and Dr. Jane has made us understand very well that these things are not strange happening. It's based on what a woman is experiencing in her body, either with respect to pregnancy, delivery, or as age goes by. So it means they are not strange. So now we'll now get into the part of how a woman actually manages her vaginal health. Because from what you've explained, some of these things might be inevitable. It either happens with pregnancy, childbirth, or age. So somehow a woman might go through this a lot eventually. So how do we actually manage our vaginal health as women watching right there? Look, how do they maintain their vaginal health? What are the safe practices to do that would actually keep them healthy?
Well, safe practices, you keep vagina healthy, keep your vagina clean, no use of chemicals, soaps, washing is use just water
Mhm.
or little mildly scented soaps. Um, Reduce as much interventions. A lot of times women try wash their vagina with their fingers in there. That is not healthy.
Healthy.
That is not
Mm.
hygienic. It rather increases their risk for recurrent infections. Now, that is for the vagina.
Hmm.
Pelvic health generally. A woman's concern would differ from another woman,
Woman, yeah,
even if they have been through the same journey.
that's
They've
right.
had two vaginal births, two big babies,
Mm-hmm.
42 together. What her complaints might be, or what she would consider a significant concern. Someone will come with looseness, some will come with laxity.
Yeah.
So, what they complain about would differ. So, counseling on vaginal health would also depend on what the woman presents with. So most
Hmm.
times when they come to you, you want to establish what the problem is. Then you can now offer appropriate counsel on and the appropriate option of management. Because some it's just weight loss, some you tell them eat healthy. Some you tell them you just need rehabilitation of the pelvic floor, maybe
Mm-hmm.
with a physiotherapist.
Hmm.
There's also Kegel exercises.
Okay.
So it's a wide range
Of
of care you
hmm.
would offer them, but the basic care, how to care for the vagina, is what we had established. And of course, sun drying underwears, ensuring that they are well ironed and changed
Yeah. Hmm.
occasionally. Yes, because a lot of times these are left in places that are moist,
Yes,
and
that's
this,
right.
yes,
Hmm. A lot of our bathrooms sees a
yeah.
lot of them. A lot of people actually shy away from sun drying actually, and it's not a safe practice. So we are noting that those of us that do a lot of indoor drying, please, that's not the best, please. Okay, yes. Any more from there, or we can move to next. Okay, so I know that for those of us watching, for those of us that have heard about Alps hospitals, one thing I know that you can be proud of ourselves in Alps is that we have a very high level of technology use. Yes, global use of technology that is worldwide accepted. So are there some technologies that actually would proffer some form of should I say remedy or some form of management to some of the symptoms that women actually deal with after childbirth or as they age? Even young ladies, there are some ladies that somehow they found themselves having laxed vagina, not like they've even given birth before. Are there ways that actually management could actually be done that would actually make a woman feel more comfortable, make her feel less of herself or improve her self-esteem? Yeah.
Yeah, so there are a whole lot that can be done for
Mm-hmm.
women across different concerns.
Mm-hmm.
For yes, we talk about the basics, conservative medications, and all. Then when we talk about technology, the
Mm-hmm.
world is going technical and
Yes,
everybody's moving with the train.
that's
Yeah,
true.
so for a lot of times, women will tell you things don't feel the same anymore
Anymore.
after I had my children.
Mm.
Yes, but that should not be, we should establish what it means. Laxity for one woman, it might
Yes,
be different for another.
it's true.
You want to establish what she means by looseness of the vagina
Mm-hmm.
or laxity,
Mm-hmm.
because that is what you commonly see for women who have had multiple births, age, advancing age women, and
Yes.
all those. Yes. So you want to establish what it is, then decide on what treatment to offer.
Yeah.
Yes, for the laxity, once you establish that, it's for some it will just be they don't have significant resistance like they would have in the vagina and all of
Mm.
that. Yes, so the technology that can be used to help improve laxity, which is a common concern for a lot of women. A lot of women feel that after delivery, but you must establish that laxity is not a prolapse,
Hmm.
like an organ protruding through the vagina, because that might just be it. But she
Hmm.
calls it laxity.
Hmm.
You should establish that she's not having any form of infection. You want to establish that she doesn't have any other concern. So a woman comes with different things, you
Yeah.
offer her treatment as appropriate. But for when you have established that is laxity, yes, laser vaginal rejuvenation is a non-surgical approach
Oh.
that
Okay.
can help improve the strength and also increase the tightness of the
Okay.
vaginal
Oh.
wall.
Wow.
Yes, it's a way of introducing some form of some energy into the
Yes.
vaginal wall, so it stimulates the growth of you. Remember, we established that collagen is a support structure, so it induces
Yes.
some changes there
Mm.
which would improve the strength and also reduces the laxity as women perceive. So sometimes while you're doing the procedure, you notice that the probe also begins to grip, the vagina starts to grip on
Wow.
the
Wow.
procedure.
Hmm.
Yeah, so
That's
improving,
interesting.
yes, the outcomes for most women.
So this is me just asking. I'm just wondering because now you've talked about a very very important technology. I know that there are some other ways before the laser vaginal rejuvenation actually came to be. I'm sure there are other ways that some women have actually tried to achieve tightness of the vagina. Some of them will do all this sitting in herbal concussion that can. So maybe give us a bit of advantage of over those their modalities. Some of them, I'm sure they've even had to. Some of them have maybe considered having a surgery to maybe reduce the tissue of the vagina to make it tight. Well, what are the advantage of the laser? What does laser vaginal rejuvenation actually prefer that would make it stand out from these other ways? I mean, going to sit in hot water is cheap. so so they will say I'll do it carefully so I will not be burnt. But
Yeah,
what does
so well, over the years, a lot of women have been advised to do what we call the pelvic floor physiotherapy, or what we call Kegel's exercise.
mm-hmm,
Yes, a lot of times this is done wrongly,
mm-hmm.
but if women understand, it's also a good way to strengthen even though that goes directly, the pelvic floor exercise strengthens the muscles of the floor. With
Hmm.
a stronger muscles, there's also some improvement in the vaginal health and the walls. But laser technology deals directly with the vaginal walls, so
Hmm.
improving, yes, the strength of the vaginal walls and all of that. So it's non-invasive.
Oh,
You don't
okay.
you
Wow.
it's not a surgical procedure, rather, so
Wow.
you don't get a cut, you don't
Wow.
see
Hmm.
blood. Yes,
Okay.
it's a procedure that you walk in and walk out. You don't
Wow.
have to sleep, you're
Hmm.
not put under any
Any
form
form
of
of anesthesia.
anesthesia.
Hmm.
So most times anesthesia is what scares a lot of persons
People.
from surgery.
Absolutely.
Yeah,
Mm-hmm.
so when you don't need them
Mm-hmm.
significant. Yes, you would need anesthesia. Yes, there's major anesthesia and minor. Yes, we do some local anesthesia just to
Mm-hmm.
give some things to reduce the pain you would experience, but you don't get those deep anesthesia. So you walk to the couch, climb the couch yourself, and also walk down the couch yourself. So you go home, you see results within a short time. Yes, there are some that will require multiple procedures. Yeah, but it's something that it doesn't take a lot of your time. You can walk in, have your procedure, and still go to work the same day and
Day, wow,
function
like nothing
maximally.
happened.
While there are also surgeries that can be done. Yes, people have talked about vaginal tightening surgeries. They're also effective if well done. But of course, this puts the woman on the bed. There is bleeding. There is also significant surgical risk and
Hmm.
aesthetic risk and all of that. Yes, so while we have all of those as things that can improve the reduce laxity in the
Yeah,
word, yes, laser vaginal rejuvenation will do most of those and also help with the stress urinary incontinence we
wow.
talked about, also improve the vaginal health at menopause. So it
Hmm.
can do
A lot.
all of those,
Wow.
yes. It's a very interesting area as
Hmm.
evidence about its efficacies emerging daily.
Wow. So, viewers, this is a lot actually, because sometimes some of us would want to say they would let them sit under hot water or let them go the surgical ways, like Dr. Jane has just mentioned to us. Yes, some of them can actually prefer some form of tightening to the vagina, but it does not fully restore the health of the vagina. It's just like she mentioned for laser vagina. From what I've learned, that she said it can help with urinary incontinence. It can restore the moisture. So sometimes with this dryness that some people complain for, because I think one thing I've picked from what she said is it helps with regrowth. And that's one thing that I think those other ones will not prefer. Regrowth of collagen fibers that would actually help to improve the general health of the vagina, maybe restore the normal flora that will fight against maybe infection and all of that. So I believe that this is a welcome technology that people shouldn't just look away from. It's something that is, I mean, easy to do. Like she mentioned, walk-in, workout. I'm sure that you've heard some people that have come from the office and just come and do it briefly.
And
And
go back
just
to
go
office.
like nothing happened. Just your lunch break or your tea break, you could just come, get it done, and then that's it. So for someone that is watching right now, Dr. Jane has made this is not a big deal, really. Like the way she has simplified it, that it's not a big deal. It's painless. Some of those other processes that people do, some of them cannot even, some you'll be dealing with maybe scars, you'll be dealing with sore. So it means that you might not even be able to return to maybe sexual activity until over a period of time that you heal. Even healing might be with scar. And then with vaginal rejuvenation, 3 4 days you can go back to your sexual activity if you are like as you so wish. So it means you stand to gain a lot more than, and then the comforts of you as a woman, because as women age, that discomfort that comes with it, any little thing there can just be abrasion. This could actually help, and she has made us know that for some people one session might suffice, maybe those people that just give birth, and it depends on the degree. That's why you will not compare yourself with another person. You will not say my friend did one session, why am I doing 3 sessions? I mean, so it can be monthly for 3 months and then subsequently yearly for the menopausal women, but still, it's something that you should consider if you are experiencing any of these. And it's not a big deal, like she has mentioned. It's not difficult to access, it's accessible, very accessible at Alps, Abuja, Alps, Jos. You can access it anywhere. Work in, work out. It's just a phone call away. I mean, there's a number. If you're interested, there's a number being displayed on the screen. You can actually just chat up, book, and then yes, it could be planned for, and you have it just at the tip, like just at your fingertip, and everything is done. So please, viewers, let's make use of this technology to restore vaginal health for those people that are experiencing one of these various symptoms. Do not die in silence. A lot of partners complain, a lot of partners, I mean, there are some men that would not want to tell their wife directly, but they might want to confide in the doctor. I mean, that's your field. Maybe you might have one or two that will complain, or their wives might be like, okay, I don't feel normal, like you mentioned, there's a regular statement that
Yes.
it doesn't feel the same
Anymore.
anymore. So it means that it's something that a lot of women would not want to talk about because of the society we find ourselves. It makes women feel like talking about this, she's a bad girl. Well, that's not always the case. It's good to have your comfort in whichever way you can, as long as it makes you comfortable, restores your self-esteem. Why not? Please do not think about whatever anybody has to say. It's just about you, your comfort, what makes you healthy, what makes you comfortable. So as we wrap up on this session today, what's your counsel to women generally with respect to their vaginal health, pelvic health. I mean, their health generally. Let's just, yeah.
Yeah, so general to women, your vagina and your pelvic health matters. And as you age, some of these changes are bound to happen, but you should not sit and assume they are normal
Hmm.
because there are different degrees to your concerns. And for whatever it is, if you have to plan your life around your bladder, if you have to plan your life around a pad because you're having an offensive vaginal discharge,
Yeah.
if you have to think about the next intercourse you would have with your partner because you feel things are not the same anymore, then you are the perfect woman we need to see. Let's talk
Hmm.
about your vaginal health, let's talk about your
Hmm.
pelvic health, and why not? There's always solution for every
Every
concern.
concern. Wow. Thank you so much, Dr. Jane. Oh, that was really nice coming from you. Thank you so much, viewers, for engaging us, for always staying glued to your screen, for taking our time to watch our videos, to like our comments, to throw your questions, drop your thoughts, and all of that. We appreciate you guys. We look forward to seeing more of you in our subsequent sessions. For now, we hope that you keep watching, you keep liking, you keep sharing, and we hope somehow that a woman out there has gotten a message that she would act on right away and hopefully see results soon. For now, we hope that you enjoy the rest of your evening. Bye.